Madam Chief of Staff, my colleague Minister for Special Development Initiatives, colleague ministers, deputy ministers, my good friend, Majority Leader, who has just joined us after Parliament, members of Parliament, distinguished invited guests, ladies and gentlemen. As the Minister responsible for health, I must say I'm very glad that we are gathered here today to witness one of the NPP government's major social intervention policy programs that will see an improvement in healthcare delivery in our country. Obviously, accessibility to healthcare is going to improve tremendously with the deployment of these 307 new ambulances. And I must confess that since taking over as the minister responsible for health, a major headache I have had has been how to support the National Ambulance Service to improve on its emergency response capabilities. I inherited a service that had personnel, but no adequate number of vehicles to be relied upon to respond to emergencies in the country with a high degree of capability and efficiency. We all do know that people's lives often depend on the quick reaction and competent care of emergency medical technicians and paramedics. Incidents as varied as automobile accidents, heart attacks, slips and falls, even childbirth, and gunshot wounds require immediate medical attention. Emergency medical technicians and paramedics provide these vital services as they care for and transport the sick or injured to a medical facility. These vital functions cannot be performed without ambulances. It is therefore refreshing to see the President's commitment in providing enough ambulances to ameliorate the situation of inadequate fleet. All efforts are going to be made to continuously support the National Ambulance Service to improve on quality of pre-hospital emergency care services. Your Excellency, we are not just providing ambulances, but we are building a holistic emergency response system. It is in this regard that a unitary emergency number for all emergencies with a 112 number will be launched by His Excellency the President of the Republic. I would like to entreat the media to assist in the public education of the use of the 112 when launched to assess emergency care in times of need. As these ambulances are being distributed today, please permit me, Your Excellency, to advise my colleague MPs and ministers. All the ambulances are going to be manned by the National Ambulance Service. The service works in close collaboration with metropolitan, municipal and district assemblies, health facilities, and all other emergency services such as the fire service and NADMO. The ambulances will be distributed to both old and new ambulance stations in the various constituencies to serve the various communities as well as health facilities. Qualified and experienced emergency medical technician drivers are the ones who are authorized to drive these ambulances. We do know that some constituencies have met the basic requirements of providing office and residential accommodation for the National Ambulance Service to pave way for easy operationalization of these ambulances. We also do know that some constituencies are a bit behind in terms of their preparedness in receiving these ambulances. As these ambulances are going to be deployed today, I'll entreat all my colleague MPs, regional ministers, and metropolitan, municipal and district chief executives to continue to collaborate with the National Ambulance Service, especially in places where the infrastructure is not ready, to identify suitable places from where to operate until such times that the necessary facilities are made available. Any support that can be provided by you to the National Ambulance Service is more than welcome. And I'm aware that some of my colleagues MPs have actually provided some ambulances to their constituencies. We are going to add these to what we have done, but I will still entreat you to continue to give the support that we have been given in the past. I would like to call on the Director General of Ghana Health Service, the CEOs of the teaching hospitals, the regional directors of health services, as well as heads of all Ministry of Health agencies to cooperate and collaborate with the National Ambulance Service as they carry out their duties in providing pre-hospital care services to the country, so that together we can all assist in building a comprehensive, effective, and efficient emergency response system for our country. Your Excellencies, I would like to use this opportunity to also appeal to transport organizations such as the Ghana Road Transport Union, the Progressive Transport Owners Association, and other transport associations to cooperate with the National Ambulance Service and other emergency services so that they assist them to gain easy access to the roads in the course of their duties. And I'm sure their cooperation will go a long way to save many lives. On this note, Your Excellencies, I wish to end my speech. And once again, Mr. President, thank you and the Vice President for your personal commitment in ensuring that this laudable project became a success. Mr. President, I want to assure you that tonight I will sleep. And I'll beg for permission to be late a little bit tomorrow morning. Mr. President, since after the deployment of the drones, or even during the deployment of the drones, I took a lot of bashing, from Parliament to radio stations to TV stations to several other media platforms. Now we don't have ambulances, and we are deploying drones to fly blood and essential medicines. And I kept on telling people and the nation that the President is committing to deliver on his promises, and he will so do. Sir President, let me thank you. You have justified my explanation. I thank you so much.